Welcome to Chapter 5. In Chapter 5, we talk about maternal, infant, and child health. We're kind of moving away from the first few chapters, which were talking about things like school health programs and community health programs, and we're going to begin looking at specific population groups, and those are divided by age, because it turns out that age is a good determining factor for which diseases and health problems that a person is going to experience. And so our book divides people up perhaps a little bit differently than the way at least I normally think of age groups. So I think it's worth defining how our book looks at the age groups. So infant is a person who is less than one. A child starts at 1 and goes all the way up to 14. Adolescents and young adults are people who are 15 to 24. Adults are 25 to 64. And then seniors are 65 and over. So today, in this chapter, we're going to be talking about maternal health. And this is for the group of people who are women between the ages of 18 to 45. And those age groups are the women of childbearing age. When their book mentions that it is women of childbearing age, it's looking at their health not just at the moment that they conceive up until they give birth. It's actually before that and then also a little bit after that. And so only half of children are planned for. And so the health of the mom before she conceives is actually impactful on the mother and the child. And so looking at pre-pregnancy health of the woman, obviously through the pregnancy, the labor and the delivery, and then the postpartum, which is that time period directly after a woman gives birth. And then the health of the child prior to birth, so not looking at the child's birth just after they're delivered, but also their health in the womb, and then also up until they're 15 years old. So, again, there's kind of these two peoples that we're looking at here. We're looking at mom specifically from the time before she conceives, all the way up until the first, at least several months after she delivers the child, and then looking at the child from the time that it's conceived up until the time that it's 15, up until the 15th birthday. So there are several risk factors here that our book kind of starts out with and says these are things to look out for, and if we can reduce these, then we're going to be better off, mom and child specifically. Unintended pregnancies, which again is about half of children are not planned for. And so if you can reduce the number of unintended pregnancies, things tend to go better. Mom who is hoping to get pregnant, planning on getting pregnant, is, for instance, going to be drinking less alcohol, is going to be more likely to take her prenatal vitamins, more likely to get better sleep, more likely to exercise and visit the doctor more, as opposed to the woman who is not intending to get pregnant, is probably focused on those things a little bit less. What else? Lack of prenatal care. If you could imagine the woman who wasn't intending on getting pregnant, maybe didn't want to get pregnant, she's going to be a little bit less likely to go visit the doctor, or at least less likely to visit the doctor as often as the woman who was hoping to get pregnant, planning on getting pregnant. Poor child nutrition, poor maternal nutrition. The mom who wasn't intending on getting pregnant, especially during those maybe like the first month before she even realizes that she is pregnant, she may not be focused on getting adequate nutrition for herself and the child. The child who has low immunizations, not receiving its vaccines, unsafe child care, and then of course poverty is sort of the cloud that seems like it follows most problems, meaning most bad things happen more frequently, at least in my view, more frequently to people who are in poverty. And that's pretty much across the board. Like every problem that I can think of, more stress, more substance abuse, more interpersonal abuse, lower education, just all those things seem like they happen in more frequency with people with poverty. When there's poverty, there just seems to be more bad things that show up. So that's just a general statement. And if these issues, these risk factors can be prevented, then it's often going to cost a lot less in the beginning, which means if you can spend the money getting mom to the doctor, getting mom to take prenatal vitamins, getting the child to the doctor when it's an infant. Yes, that costs money and resources, but generally that's a whole lot less expensive and time-consuming and heart-wrenching than if you don't do those things. It's like the Benjamin Franklin expression, an ounce of prevention is worth a pound of cure. Except in this case, it's usually worth a lot more than a pound. The most, heart-wrenching and dramatic, which would be the death of an infant. 13.8, although this data is probably a little bit dated, 13.8 black babies are not going to make it to their first birthday, as compared to 5.5 Hispanic babies that are not going to make it to their first birthday. This statistic is called infant mortality. Overall, the U.S. has a high infant mortality rate. Again, infant mortality is the number per 1,000 children that are going to die before they reach 1 year old, which is when you graduate out of infancy into childhood. On average, we have 6.9 per 1,000 infant deaths. This is 30th in the world, right? So there are 29 countries that have better infant mortality rates than us, but I guess that leaves 140 roughly countries that have worse. But considering we are so affluent, so wealthy in this country, that's why a lot of people say that we could be doing a lot better in this statistic. So historically, even though we could be doing better, historically infant mortality rates were much higher. In fact, giving birth to a child from the mother's perspective was a fairly dangerous thing to undertake. And many more children died in infancy in the past than they did today. In fact, it wouldn't have been uncommon hardly at all for a large family, one that had, say 10 or 12 children born to it, to have 2 or 3 infants die before they turned 1. As infant mortality rates have fallen, we have noticed new things that are related to disease. For instance, while infant mortality rate was much higher, it's not just sort of like a random kind of crapshoot in terms of which infants die and which infants live. There are things that are associated with higher infant mortality. Things like how much poverty is in that family. What are the social environments like for the child? How much education do the parents have? What kind of substance abuse is going on? What kind of perhaps interpersonal abuse might be going on? So the book recommends that as a society that we focused first on the health of women who are of childbearing age. For instance, if we wanted to improve infant health, which is pretty common because most people would say, infants are innocent and we want to care about children because they haven't made any choices for good or for evil, and so we should improve their lot in life, then we would say, okay, great, then we need to focus on women of childbearing age. Again, not just those who are planning on having children, but every woman who is of that childbearing age, which is women between 18 and 45. Although I would say you're probably going to focus more heavily on the 18 to, say, 30 group, as they're less likely to be educated, they're more likely to be in poverty, that would be a group to focus on. How is their health? What is their nutritional norms like? Are they visiting the doctor? Are they in a stable economic space? Teenage pregnancies. Even though we're talking about 18 to 45-year-olds, we know that people can have children before they are 18. And so looking at teenage pregnancies specifically, this is a risk factor for a few different reasons. Looking at moms specifically, if a teenager gets pregnant, their odds of dropping out of high school have just increased significantly, as are the odds that they don't get married. And if they are married, that marriage is going to end in divorce. It's much more likely that they are going to rely on public assistance and live in poverty. It's estimated that teenage pregnancy costs the United States about $9 billion a year. This would include things like healthcare costs, foster care, and then criminal justice. Are more likely to smoke while they are pregnant. It's more likely that they are going to have preterm babies, low birth weight children, and more likely to develop anemia and high blood pressure during that pregnancy. So, babies born to teenagers are more likely to die in infancy and more likely to have certain health problems. Find yourself in that situation that I've just described. There are things that you can do to counteract the risks that I've just described. But from a public health perspective, like a macro looking down on society, these are more likely to have negative outcomes compared to women who are having children a little bit later on in life. Rates of teenage pregnancy have decreased in the past few decades significantly. As you can see here in my chart, the rates have gone down. They've gone down around the world, but the United States still has a lot more teen pregnancies compared to much of the rest of the rich world. So, I could used to kind of argue that teenage pregnancy was something that was sort of it was okay in the past because we lived in a different society. People were much more extended family focused. So maybe, for instance, teenagers would have gotten married in times of the past, and the extended family would have been there to support pregnant mom in a way that today extended families are not there. And I think that to some degree that is true still, but if you look at the biological issues that crop up, low birth weight babies, more likely to have anemia, more likely to have high blood pressure. It's almost like the teenage body of the woman isn't quite ready to carry that child as successfully as the body of an adult woman. I mentioned that half of babies are unplanned. Again, this is kind of more likely leads to a negative outcome. For instance, about 40% of the unplanned pregnancies lead to abortion. And it's also associated with other negative risk factors, such as poverty and the mother not wanting to be a mother. And while sometimes mothers who were not planning on getting pregnant welcome that child into their life, not all of them do. And even sometimes women who say that they're grateful for their child, like pretty much every mother, whether they were planning on having the child or not, when you ask them, are you glad that you have the child now that the child is out of the womb and maybe crawling around or even talking, generally it's I love the child, I'm glad they're here. But there have been studies that are showing that even that mother looks at the child differently than the mother that was planning on having the child. Again, not always, but sometimes if you look at things like how many positive words does the mother say to the child, how many positive activities does the parent do with that child, like reading with the child and playing with the child and just kind of making that child like an important part of their life. There's evidence to show that parents who don't want the child, especially parents that say wanted an abortion and then didn't receive one, there's something different with those mothers. And so that's why all that is to say, family planning seems to be a positive thing with for families, that where the parents, or the mother at least, is saying, this is how many children I want, and this is what I'm going to do to, say, prevent children from being born, and this is, kind of just even talking through that with a doctor or healthcare professional. Risks that are associated with unintended pregnancies include smoking and drinking while pregnant, not getting recommended prenatal care, and then not gaining the recommended weight while the woman is pregnant. And so a lot of this is to encourage preconception health care. What health care can women receive before they conceive that child? And this is kind of has to be pretty broad, because if you just ask women, are you planning on conceiving a child? And if they say no, then you kind of don't focus on it. It's like, no, you kind of need to focus on every woman that's of childbearing age, because even if the woman is not intending on having a child, if she's sexually active, and even if she's not at that moment, if she is in the future, then there may not be that time to focus on preconception healthcare. And so to kind of tackle this, there's Title 10, which is exclusively about family planning. It's been around since the 1970s, and its goal is to reduce unintended pregnancy. And one of the ways that they do this is to provide contraception to poor women specifically. This comes through the local health departments, Planned Parenthood, and other family planning councils. Now, it's somewhat controversial, because one of the original parts of this program was to talk to women about abortions and options after they're pregnant. And if there is a kind of like a conservative president, then they eliminate that part. And then if there's a more liberal president, then they include that part. And so it kind of a back and forth depending on which party is in power if they go ahead and do that. So Margaret Sanger was a maternity nurse about 100 years ago. And what she found was that women didn't know how to prevent births. Right? By the way, birth control has been around for thousands of years. It's just that it hasn't been as effective as it is today. And not all women knew how to use it effectively in order to prevent births. And why is this a needed thing? Again, kind of going back to what we just mentioned, unintended births are a risk factor for child health, for mom's health as well. And so Margaret Sanger found that women didn't know how to prevent births, and so she started the National Birth Control League, and it was trying to empower women with the ability to prevent unintended births. From this came Planned Parenthood Federation of America, which is very controversial, and many times when people hear Planned Parenthood, they immediately think of abortion clinics, and they do provide that service, but they also provide a lot of additional services to that. Remember, this was started a long time ago, and before abortion was legal in the United States. And they were doing things like family planning and child nutrition and maternal health before they provided. Sorry, it's so hard to talk about abortion because it's so controversial, and every little word that I say is going to piss off some group or another. So trying to be non-partisan on this one. Planned Parenthood is the largest voluntary reproductive health organization in the world. It's a non-for-profit organization. Let's talk about abortion, though, just real briefly. Abortion is the voluntary expulsion of the fetus from the uterus, right? And this is important because in like a hospital setting, they will refer to a miscarriage as an abortion. And so when we're talking about this type of abortion, we're talking about the voluntary. Family planning programs, which again, Planned Parenthood is one of those, but there's obviously other ones as well. They have prevented abortions. In fact, abortions have been gone down significantly, at least for the last 30 years in the United States. And they credit that to family planning. So, abortion has been legal since the 1973 when the U.S. Supreme Court declared that women with their doctors have the right to a legal abortion in the early stages of pregnancy. One of the interesting things is that if you were to look at a map, and maybe I've got one right here, there seems to be little connection between the legality of abortions and the prevalence of them, which means you can go to some countries where abortion is illegal and you have a lot of abortions occurring, and you can go to other countries where abortions are legal and you don't have that many of them occurring. So it doesn't, I don't know, there doesn't seem to be that much of a connection between whether abortion is legal or not and whether they occur. So, the presence of birth control seems to be the thing that lowers the number of abortions, not the legal restrictions, right? So that's, one of the things that Title X tries to provide is birth control, because that seems to make the difference. Whether people have birth control, whether they know how to use it or not, that is the thing that controls whether or not women seek abortions. So. All right, well, let's talk about maternal health. Maternal health looks at health during a woman's childbearing years. Mortality for the woman who is pregnant or giving birth used to be much higher. And so we've made a lot of improvements. There's been a 50% reduction in maternal mortality, which means the rate at which women are dying during pregnancy and delivery and postpartum between 1970 and 1982. But still, even though it's much safer today, they still estimate that half of the number of maternal deaths could be prevented. For instance, Black women are 4 times more likely to die from pregnancy as compared to white women. Again, this racial disparity is not due to biology, it's due to external factors like whether the woman is going to the doctor and receiving prenatal care. Prenatal care is care that is given before the child is born. This is going to include things like testing for risks, treating complications while the child is still in the womb, monitoring the growth and development of that child. Things that are good are things like exercising, nutritional guidance, gaining weight, and then overall health of mother. It shouldn't be a surprise that if mom is healthy, it is more likely that the child in the womb is going to be healthy. It's almost like whatever happens to mom is happening to the child. But realize, though, that women have been giving birth and have been carrying children and giving birth all throughout history, and so we may think that, war and famine and drug use and domestic violence, these things are terrible for the child in the womb. And so while I might agree with you, I would say that yes, but somehow we have survived, wars and all these terrible things throughout history, and yet humans are nothing but very adaptable, and we're survivors, so don't feel like if something happens, like a car accident, for instance, that the child has irreparable damage. It's likely that they don't, because again, these things have happened throughout history over and over again, and yet we still make it, we still survive. All right, women with no prenatal care are 3 times more likely to deliver low birth weight babies. Right? So if a woman is not receiving care while she is pregnant. She's a much higher risk of delivering a child that has inadequate birth weight. By the way, this is less than 5.5 pounds. That child is also 4 times more likely to die in infancy. And so prenatal care is a major policy goal, especially those first 3 months, or that first trimester. They break up a woman's pregnancy into 3 parts, trimester. And so that first 3 months before maybe mom is even showing and maybe no one's noticing, so no one's asking her about the pregnancy, and so maybe she isn't going to visit the doctor because it's too early, something like that. So getting mom to go see the doctor during that time is important. All right, looking at infant health, after the child is born, before the child turns 1, this is often impacted pretty highly upon mom's health, and not just mom's health during pregnancy, but also mom's health before conception, right? The environment after delivery, is it warm? Is it safe? Are there, is the bed, is it clean? Is the child being cleaned? Is the child being fed? And then how is the care of that child? Or is the child being held? Is the child getting, adequate sleep? Is the place comfortable and healthy for the new child? Most infant deaths take place during that first month of the child's life. Oftentimes it's related to low birth weight, or the child is born premature or born with birth defects. A premature birth is one that is born prior to 37 weeks. Normal gestation, which is from the time the child is conceived before they are delivered, is about 36 to 42 weeks. I oftentimes just think of 40 weeks, but it can take longer than that. And by the way, it is the child that sends the chemical to mom's body that induces labor. Well, unless the doctor does it. But generally, it's the baby, which I find kind of fascinating, that the child kind of decides, I'm ready to be born. And so what are the problems with premature birth? Well, the organs themselves are not as developed as they would be if the child remained in the womb until 40 weeks or until 38. I believe the last 2 weeks, I believe, are just about adding fat, but that doesn't mean that they're not necessary. It's just that I believe that organ completion is done by about 38 weeks. And so if the child is born premature, they're more likely to face health issues after delivery. Premature babies, all right, about half of premature births don't have a known cause, right? However, there are some risk factors that are associated with premature births. For instance, if the mom's previous child or children were born premature, it is a higher risk that her next ones are going to be as well. If there are multiple fetuses, meaning there's twins or triplets, higher risk for premature birth. If there's a lack of prenatal care, if there's cigarette smoking or substance use, if there is a lack of social support, I imagine this specifically for mom. There's lower income, if there's diabetes or blood pressure that's high, obesity, younger than 17 or older than 35. Going back to low birth weight, this is the single most important factor in neonatal death. Neonatal is newborn death. It's a significant predictor of neonatal mortality and childhood morbidity. The average child weighs about 7 pounds. Low birth weight children are again about 5.5 or lower, and they're about 40 times more likely to die in that first year. About 2/3 of low birth weight children are born premature. It makes sense that if a child was born before their due date, that they would be smaller and weigh less. But 1/3 of them are born about the time when they would be expected and still are low birth weight. So, what should pregnant women do? Prenatal care is the first one, going and visiting the doctor, because the doctor will oftentimes recommend the next parts, which are eating a balanced diet, gaining the recommended amount of weight, and not using substances. The American Academy of Pediatrics recommends that children be breastfed for the first year. Breast milk is good to help children fight infections and other diseases, especially that first milk that a new mother produces, referred to as colostrum. Milk is good to help resist infections and other diseases. Babies that are breastfed have fewer infections, colds, less diarrhea, they vomit less often. It also turns out that it's really good for mom as well. She returns back to her pre-pregnancy weight faster. It also reduces postpartum bleeding and reduces the risk of osteoporosis. So, in 2005 to 7, about 75% of infants had been breastfed at least one time in their life, but only about 43% of 6-month-olds were being breastfed. And so a lot of people are not following the recommendations of the American Academy of Pediatrics. I imagine a lot of this is due to the fact that it is difficult for moms who are working, especially if they're working full-time outside the home, to breastfeed. Breastfeeding is highest among college-educated women who are older than 35 and who are participants in WIC, which is a program that we'll talk about in a second. Breastfeeding is least likely among mothers who are younger than 20, have low income, are Black, and are not working. There are a couple of organizations that assist women specifically on how to breastfeed their children, which is not always the easiest thing, and that is La Leche League and Nursing Mothers Council. So, sudden infant death syndrome, referred to as SIDS, is where the child dies and there's not an immediate obvious cause. About 4,500 babies a year die of SIDS, and it is the third leading cause of infant death. The recommendation that children sleep on their back has reduced SIDS by about half over the last 30 years. Child health, so we're moving away from infants. We're looking at children from 1 to 14. Child health can be kind of thought of as foundational. That the health that we have as a child kind of lays the foundation that we're going to build the rest of our health on. Unfortunately, many children grow up lacking a safe environment that is sanitary, and the safety of many child care facilities could be greatly improved. Unintended injury is the leading cause of death among children. And so while I may think of playground equipment, it's actually motor vehicles. It's more common here. And oftentimes when a child dies in a motor vehicle accident, it's because they are unsafely secured to within the vehicle. The car seat is not securely attached if there is a car seat. All right, well, moving on to child morbidity. Again, morbidity is related to disease. About 25% of children sustain injuries worthy of bed rest. If we move away from unintended injuries and move to child maltreatment, this is a painful topic to talk about because we like to think of childhood as being a time of innocence and safety and exploration, but unfortunately that isn't the case for all children. So maltreatment is a general term. We used to think of it as child abuse and neglect, but it's not it also includes things like sexual abuse, abandonment, or threats, emotional abuse. So all those different things, verbal, physical, emotional, sexual, abandonment, threat of harm, all of those injurious things can be referred to as child maltreatment. Right? And child maltreatment can have a pretty detrimental effect on children that can last, unfortunately, into their adulthood. And it can affect things like delaying their growth. And it can create physical injuries in their body. It can create psychological problems that change the way they think about themselves or change the way they think about the world. In terms of how much maltreatment occurs in the United States, our book says 10 to 15 per 1,000 children. I would say it's really hard to estimate the amount of child maltreatment that occurs because most of it never comes to the attention of the authorities. And even that which does come to the attention of the authorities, it is difficult to prove child maltreatment. And so, I'd say it's probably at least triple that amount that occurs. And especially during times of stress, when the economy is poor and there's maybe political upheaval and people are angry, rates of childhood maltreatment are going to go up. So the assumption in the United States is to give parents the freedom to raise their children as they see fit, but they must keep them away from harm. And if they cannot, then the state steps in and tries to correct the problem, either by, and usually by, helping the parents in the ways that they are falling down, or in the case of where they can't do it, then stepping in and removing that child and trying to put them in a better place. All right. Well, let's talk about infectious diseases. We mentioned, I think, in the first chapter that infectious diseases are less of a problem, COVID aside, but in general, over the last 50, 70 years, infectious diseases are not as much of a problem as they have been for people of the past. We've developed vaccines for many of the infectious diseases that were disabling us and killing us of the past. And about 8 out of 10 children receive the recommended vaccinations. All right. I mentioned WIC in the past. And so WIC is a program that is developed to improve the lives of women, infants, and children. In fact, WIC stands for Women, Infant, and Children. And so in addition to WIC, there are many other community programs for this population group. And starting with WIC, WIC is a supplemental food program, and it is for women who are pregnant or have previously given birth in the recent past, women who are breastfeeding, and women who have children under 5. It is housed under the U.S. Department of Agriculture, and it is given to women who are below 185% of the poverty line, which means you can be impoverished and receive WIC, but you don't have to be impoverished. You can be above the poverty line, but not too far above it, and still receive the WIC. It's especially focused on people who are at nutritional risk. For instance, you don't want an infant to not receive adequate nutrition. And so what do? Well, as a government, you focus on giving mom and mothers-to-be and new moms the nutrition that you think would benefit her and the child. And so that is why if you go into some grocery stores, you'll see like little signs next to the food that says this qualifies for WIC. In 2008, about 10 million women and children received it, and it has proven to be one of the more effective ways to improve the health of this group. It is pretty popular among government officials, meaning typically, liberal politicians like programs like these, but conservative politicians don't like them as much because there's a fear that they're going to be misused or that people that don't really need them are going to receive them. But this one is harder to abuse, and it's pretty focused on just a specific group that's, fairly, innocent, children and new moms. And so it has pretty broad support in the government. And it's pretty effective. They estimate that for every $1 that they spend on this program, they're saving $4 in the future. So, talking about children's health insurance. So children can be insured by their parents' health insurance, especially if the parents receive their health insurance through their employer. But many employers don't offer health insurance to their employees. And oftentimes the insurance that they do offer to their employees, if they add their children, it can be much more expensive than just insuring the employee. And so many children receive insurance through Medicaid. And Medicaid is the federal program that's focused on poverty. Medicaid aid. I was thinking about aid as being toward those who are a little bit poorer, and it's based upon income. And this program actually mostly is given to women and children, and children represent half of all Medicaid recipients, which I found interesting because when we think about poor people, we typically think about men, and specifically older men. That's a really old, outdated picture that at least I have in my head, because a more accurate one would be looking at women and children, especially single moms and children. So half of all the people who receive Medicaid are children. But Medicaid is kind of choosy in the terms of you have to be below the poverty line in order to receive it. But there's another program that, again, kind of like WIC, it doesn't just focus on people who are below the poverty line, but those who are a little bit above it. And so there's a program for that. Again, we're talking about children's health insurance, and that's called CHIP, or Children's Health Insurance. And this is given at a state level. Illinois has it, Missouri has it. And what it does is it helps families with children who are up to twice the poverty line. So if the poverty line is, say, at $30,000, you can make up to $60,000 as a family and still qualify for it. However, in the United States, still 10% of children are uninsured. Well, let's talk about childcare, and that'll be the last thing we'll cover today. Childcare in the United States is more needed than ever before because you have more parents who are working outside the home than in the past, and many children don't have an adequate place to go. And so let's start by talking about the Family Medical Leave Act. This was a law that was passed in 1993 under President Bill Clinton, and it was trying to give women who had just given birth some time away from her job and she wasn't fired, to make sure she wasn't going to be fired, right? It does not provide any paid benefits, which actually makes us as a country pretty unique. Every other rich country in the world, and pretty much every other country in the world, period, although there are some other countries in the world that don't provide paid time off for the mother after she gives birth. So what this law does is it kind of just holds the job for the new mom, but not just new mom. It could be that somebody is sick or caring for a sick parent or child, or has just adopted a child. And it's a good start, I guess, but it only applies to businesses that have 50 or more employees, and the person has to have worked there for a year or more. And again, there's no guarantee of pay. Now, sometimes people take their vacation time, or if they have sick leave, then sometimes they can receive that money. But some people, would really advocate, and I'm one of them, that would say we could really do better off by saying, you know what, let's force the companies to give the new mom 50% of her salary or 60% of her salary. And we can just do that for 3 months, Some countries, like in Northern Europe, they actually give mom and dad a year paid off at 100%, and so we would probably be petrified of doing that in the United States because we feel like people would just start having children left and right just so they could get paid. But it hasn't happened it hasn't happened in Northern Europe. Maybe it would happen here. I don't know. Much of the child care in the United States is inadequate, unfortunately. And what I mean by inadequate, meaning it's not as sanitary as it needs to be. It doesn't provide the number of enrichment activities that it could. And I don't necessarily blame the child care facility at all. They're not well paid, and oftentimes the people who are needing the child care are unable to pay more than what they are currently paying. By the way, it's only $4,000 to $10,000 per year per child, and so it's high stress, low pay job for somebody that's running a child care facility, and so that's why a lot of people would advocate that the government can do more, and the government does do some programs. For instance, around here there is Southern Seven. What's it called? It's a preschool, in Anna. They have a Sunrise preschool on the Choate campus. But we could do better. And for instance, the children that do go to to adequate child care facilities tend to do better in school. Some facilities are just places where children are kind of just like a holding cell for children. There's maybe a television and there's a couple of toys, but they're kind of, there's not like enrichment activities that are multi-sensory and bright, well-lit rooms and being taken outside and experiencing different things and being taught how to draw or, things that would, otherwise make children better prepared for school and for life and for socializing, things of that nature. So, all right, last thing here. The American Academy of Pediatrics. This was started back in 1930 by a group of doctors who wanted to create an independent organization that just focused on the health of children and treating their health as being different from those of adults. And they focus on things like researching what works well for children, advocacy, standing up for the health of children and saying, no, this is bad for children's health. Please don't allow this, this item to be added to children's cereal. And then also educating people about how to best care for children. So, alrighty, well, that is chapter 5.